So we're here with Moshka, and we are going to talk about how to look at a aging face and what I think about, and how to analyze what I see. Now, you have not had anything done at all.
Yeah, before, not now.
Okay, but no fillers.
No.
No, not in a long time. We've given her lip fillers before.
Okay, so she's had lip fillers before, and she's had a little bit of Botox before, but nothing else. No structural work, and no real kind of structural fillers in the past. So, okay, so the first thing I'm always going to be looking at is the shape of the face, right? A oval, more in a female, a more oval shape of the face is younger. A more square shape of the face is more masculine. It's also and it's older. And so what I'm looking for here when I say shape of the face primarily is I look at the zygoma and how far laterally the zygoma comes, and I'm looking at the bigonial distance. So bizygomatic distance and bigonial distance. The bigonial distance should be smaller than the bizygomatic distance to make a more oval shape of the face. You know what I mean? But over time, the masseters grow because of teeth grinding, because most people grind their teeth. And over time, this area, the zygoma, the cheekbones, they shrink because tissue, all tissue shrinks, bone shrinks, and so you get a loss of volume. So this comes in and this comes out. So a facial shape that looks like this now suddenly looks like this, right? And so we want to bring this back to this. Now, so to bring this to bring this to this, what I have to do is either bring this out like that, or bring the bottom in like that, right? And so, or both, which is what would be nice. So let me see. Clench. You grind your teeth. I think it feels pretty strong. So I would bring her masseters in a little bit with Botox, and then I'd also bring her zygoma out a little bit using a sturdy HA filler, something like Lift, Voluma, something that really keeps its shape. It has a good G prime, and I can use it to project tissue well. And so those fillers are pretty good. Volux is coming out soon, and that'll be really a very, very nice filler to use for facial sculpting and to use for projection. And all these fillers, Volux especially, last a very long time. And so that's something that where the effect of what we do gets, you have it for a long period of time, which will be nice. So that's the first kind of thing that I think about, right? The second thing that I think about when I look just kind of overall at someone's face like this, and there's a bunch of stuff to pay attention to, but I guess I analyze in a certain order just to make it, and I analyze in that order every time just to kind of make it habitual for me, to make it something that I just do every time, the same way. And so the second thing I think about after shape is I think about volume loss. So where do we, because aging is volume loss, and so and different people age differently, so different people lose volume in different places. So some people lose volume a lot in the cheeks and here, some people lose volume a lot in the soft part of the cheeks, some people lose volume a lot in the temples. And so depending on the person, it's different, and it's a different combination, it's a different pattern of volume loss. So for you, what I see is a little bit of all of the above, but your volume loss is not too bad. You've kept your structure fairly well, which is nice. You've had a little bit of loss in the temples right here. So we have some volume loss here, and we have some volume loss in the cheeks, in the malar cheeks here. So the zygoma we've already spoken about, where we want to bring that out for it to look like that. But in the cheeks as well, we want to round out the cheeks and bring them out a little bit. And now that will do two things. And most importantly, what it will do is it will frame the eyes, both by smoothing the temples, bringing out the zygoma a little bit and adding volume to the malar cheek, it will make a nice frame around the eyes. And when you frame something, as always, when you frame something, it attracts attention to whatever it is you're framing. You put a picture on the wall, you frame it, your attention goes to the picture. Same thing with the eyes. When you frame the eyes, your attention comes up from everything else. When the cheek is flat, when there's hollows here, when I look at your face, when I look at someone's face like that, I'm looking everywhere else. When this is nice and full, and I look at the person's face, my eyes go to their eyes, and that's what I want. So it looks like it's lifted, and that's a big goal in terms of facial rejuvenation. Now, a lot of people, they'll look to their nasolabial folds over here because that's what they notice. To me, that's not super important. It's when they're there, it's nice to make them softer, but that's not what the main thing that makes someone look younger or older. It's the volume and it's the framing of the eyes that's really the most important thing. You know what I mean? So I think that would be certainly a big goal. Now, of course, I'm not talking about bringing, because we've all seen the Beverly Hills kind of like overinflated look. That's not what we're talking about. We're talking about a natural, a look that's not overdone. So that's super important. So I think that's important in general. Next thing is what I'm looking at is just certain areas that give away age, and some of those areas are the forehead. Some of those areas, one of the areas, the tear trough in this area. Sometimes marionette lines and these kinds of things. For you, interestingly enough, your tear troughs, there's nothing. You don't have any hollows here, which is really nice. Most of the time, I do. A lot of people do. Much younger, they have profound hollows in this area, and when they do, a shadow drops in here and it looks like the person's always tired. When you fill it in, it looks really nice, and again, it takes distraction away from the eyes. You really don't have anything there. A little bit of pigment here, but no big deal. So I don't think we need to do much of anything over here. But in the forehead, so it's interesting because the forehead, the female forehead and the male forehead are different, and they're different contours. With the female forehead, it's curved and soft, and convex, so it curves out. With a male forehead, it's flat or even concave, right? And the interesting thing is that as women age, they start to look more masculine. As men age, they start to look somewhat more feminine as well, because their sharp features kind of soften. So for women, what I look at the forehead and see, is this concave or convex? And for you, it's a little bit, it's flat. It's maybe a little bit even concave, or right over here. So it'd be nice to kind of round this out and fill this out a little bit, if we want to do that. Now, it also, but I mean, but then that's the thing. Everything I'm talking about is just what I see, but not everything I see may bother you, and we can't necessarily do everything that we want to do, and so it's also what bothers you. So I can just tell you what I see, and you may say
all the information is very good.
Yeah,
I love it.
So I'll just say, so sometimes people say, you know what, yes, I understand that, but I don't care about that, or yes, I understand that, I really care about that. The other thing that I see for you, which is common, is that even though you don't have volume loss in the tear trough area, you do have volume loss above here, which is called the A-frame deformity. And your eyes are fairly deep set, and you have some volume loss over in this area, which used to be probably soft and more tissue in here, and that has gone away over time, causing a little bit of a hollow right in this area. So what would be nice to do is to go through here with some filler, fill this area in where this kind of comes down a little bit more and hides this little indentation. I think that would be certainly nice. So one of the things that's really very important when you're evaluating someone's face in general, for whatever reason, is whether it's for aging face or whether it's for attractiveness and proportion, you want to look at the face in all different angles. So here you want to see where how the definition is of the jawline. You want to see what the malar and zygomatic area is from this angle. You want to see it from this angle. You want to see it from this angle. You want to see it from all different angles because people take pictures from all different angles. And so what looks good from one angle, and you correct it and you send them off, they could come back and say, hey, you know what, your work is not good enough because look at these pictures. I don't look so good from this angle. And it would be a shame to not have evaluated your results from all the different angles to make sure that it was perfect. So I think so your jawline, let me see. Yeah, your jawline is fairly well defined. You know, a lot of times having good definition of the jawline is really is important to an appearance of youth and an appearance of health, and to appearance of youth and an attractive appearance. I think my first priority would be to bring this in a little bit so that you get an oval, and then afterwards I may define a little bit better the angle. So turn this way. I may define the angle of the mandible a little bit better to give a sharper jawline. So you see how this probably used to come like a little bit more here, so it used to be sharper, and this has come over time. This has probably come up here, so the angle of mandible has probably lost volume superiorly, and so now the jawline is more curved like that, whereas it used to be probably sharper and more defined like this. So restoring that sharp definition, I think after we bring this in, would be not a bad idea. Interesting, right? When I speak about as women age, they start to look more masculine. So here's another example of that. With the brows, with men they have a protruding brow, and with women their brows are more flat and blend into the rest of the forehead. But the interesting thing is, as we lose volume everywhere, right? We're losing volume in our foreheads and we're losing volume above the brows. So when we lose volume in this area, it looks like there is a protrusion to the brow because it's now no longer blended in with the rest of the forehead. And so you have a little bit of a hollow right here where it looks like a protruding brow. It's easy to correct because it's not an issue with the brow, it's an issue with what's going on above, with loss of volume in this area. So filling this in and blending it together, it will give you a more feminine appearance to the brow line in general.